Our country's large immigrant population also struggles with trust. They must overcome the fear of being in a country where everything is new, including the language.
Hey, my name is Noemi Santos and I am from Mexico. Well, when I came here, I didn't speak any English, and I came because my parents were living here. When I came here, I was 19, so I didn't go to school.
Many immigrants come to the United States every year and encounter an unfamiliar system, a new environment, and a new language. These barriers are not just a challenge for immigrants, but also for healthcare providers.
Well, at the first time when I came, I feel like scared because it's a different place. I didn't speak English, and my plans were just come 1 year and go back to my country. But then many things happened, so I decided to stay here for long, and now I'm here for 11 years.
Well, first of all, it's important to note that there isn't one particular Hispanic culture. We have such a diverse Hispanic community in the United States, and we have people that are coming from various countries, various socioeconomic statuses in those countries. And so when we're talking about first-generation immigrants, second-generation immigrants, there are differences. When we're talking about new immigrants to our country, a lot of times we are dealing with individuals who are unfamiliar with our system, our healthcare system, with our social service system, and have a lot of barriers in learning how to access those services. The program that I work with is called PASOS, and we're a part of what we call the Hispanic Health Initiatives. What the healthcare system was noticing was that many of the Hispanic families that were coming in for services were having challenges in being able to understand the services, and the system was having a hard time being able to reach that community. One of our largest initiatives is the Promotores Project, which you could translate that to community leaders or community navigators. And specifically what community leaders or promotores are, is they're individuals from the Hispanic community that have come to this country, that have struggled with some of the same barriers that their peers and the rest of the Hispanic community, and they have now learned to access the system, use the system. We take them through leadership training, communication training, help them understand how to navigate the system, and allow them to use their own strengths and their own knowledge to be able to share with their communities. And the idea is that this kind of helps break down that barrier of trust that exists within the Hispanic community and the medical community, but it also helps to break down the language barriers, and it helps do it in a way that is more familiar to a lot of the Hispanic community.
Well, my work is just to help my community. As they don't speak English, and I don't speak English very well, but I'm trying. The things that I know, I have to share with them. If they need something, I can help them with my neighbors. If they are Hispanic people, I help them. When they don't speak English, I try to find places where they can go to have classes and learn English also, like me. Well, we don't know the culture from this place. We feel we are not in our place. So that's a principal barrier because we have to learn places, we have to find where to go to the doctor, where to find schools. We are not in touch with the neighbors because we don't speak English.
So there is definitely a growing trend across the United States to incorporate what we call cultural competency into health profession education, because I think what we're starting to realize as a nation is that it's not as important to teach people how to interact with the medical system. It's not the only factor. We also need to look at how the medical system interacts with people. And introducing cultural competency isn't so much learning how to talk to people from different countries or different people with different languages. It's learning to understand the social factors and the culture of individuals that are also here in the United States, and how they understand health and how they understand what needs to be done to promote good health.
Poverty, violence, access, language, and trust are daunting obstacles to health. And as diverse as these challenges are, so too must be the solutions that can overcome them.